afternoon, everyone, and welcome, dear viewers, to this FB Live by Sanjeevani CBCC USA Cancer Hospital, Raipur. I hope all of you are doing well. So, as we know that April is Head and Neck Cancer Awareness Month, so today we will talk about the important aspects of head and neck cancer. And for that, we have an expert with us, Dr. Satish Devangan. So, welcome, doctor.
Thank you very much.
So, let me tell you that Dr. Devangan is a consultant radiation oncology at CBCC Raipur, and he'll let us know more about the common and uncommon aspects of head and neck cancer. So, doctor, can we start
Okay.
with the questions?
Yeah, we can start. Very good
Okay,
afternoon
okay.
to all of the viewers.
Yeah. Thank you so much. Also, doctor, you can, if you want to, you can throw the welcoming remarks.
Basically, we are here to discuss about various aspects of head and neck cancer. What are the types? What are the staging? What are the sites where it is involved? And what are the various risk factors and all the treatments available with us for the treatment of head and neck cancer? And in the last, what are the rehabilitation procedures for uh, patients who are treated by head and neck cancers?
Sure, doctor. And we are very sure that our viewers will receive, like many common and uncommon questions, answers to
Yeah,
their
yeah,
questions. Yeah.
yeah.
Okay. So, doctor, my
We'll
first
try.
question is, sure.
Yes,
So, my first
yes.
question is like, what is head and neck cancer? Let's start with this.
Okay. So, before starting to head and neck cancer, let us discuss something about cancer. So, cancer is basically an uncontrolled growth of any cells. Whether it occurs in any part of the body, it develops in cancer. It can be benign, it can be malignant. So, when this type of growths are developed in head and neck region, we can classify it as head and neck cancers. So, any uncommon, uncontrolled growth which are not normal, so it can be classified as head and neck cancers.
So, doctor, my next question is, what are the symptoms of head and neck cancer?
Okay. Before going to symptoms, first we have to understand the sites of head and neck, where all these cancers can be developed. So basically, head and neck is a major area. So for the sake of treatment, for the sake of classification, we have divided it in various sites. Like for head and neck, we includes oral cavity, जो आपका ये मुंह वाला हिस्सा है. Then the area behind oral cavity, which we called as oropharynx. The area above oropharynx is nasopharynx, and area below oropharynx is hypopharynx. And the air pipe, which we included it as larynx. Beside that, the air sinuses, which are called paranasal sinuses, and the salivary glands. So this all included in head and neck cancers. So going to back to your questions, what are the symptoms? So symptoms depends upon the site of involvement of the cancer. Like if it is involving oral cavity, we can get either whitish or reddish patches over the buccal mucosas, then growth or painless ulcer to start with in area of involvement. Then there might be few episodes of bleeding also. Then if it involves the air pipe or larynx, we generally says, then it can be lead to change in voice or difficulty in breathing. Beside that, neck node is also common. Then area of involvement of paranasal sinuses will lead to blocking of nose, running nose. Then features of sinusitis which are not getting cured by simple antibiotic treatment. So this all constitute symptoms which depends upon site of involvement of head and neck cancers.
Okay. Thank you, doctor. So, doctor, are there any risk factors for head and neck cancer? I mean, there are
Yeah,
certain risk factors that put at risk.
yeah. If we consider head and neck cancers risk factor, then the major chunk of this risk factor are associated with tobacco and alcohols. In various association, it has been found that almost 70 to 80% of the cases of head and neck cancer are associated with addiction. That is mainly by alcohol and tobacco. हमारे जैसे इंडिया में भी हम बोलेंगे, इफ गांव वाले जो क्षेत्र में यदि वो कैंसर मिल रहा है तो वहाँ मोस्ट कॉमन होता है जो स्मोकलेस टोबैको जो होता है, जो च्यूइंग करते हैं, ये एक कॉमन कारण है। आप अर्बन स्टेट की ओर, अर्बन रीजन की ओर जैसे रुक करते हैं तो अल्कोहल एंड दैट स्मोक स्मोक टोबैको लाइक cigarette. These are all most common risk factors associated with head and neck cancer. Besides that, some infections which have now established connection with head and neck cancer, mostly HPV infection, human papillomavirus infection, which is associated with, it has established now that it is most of the time it is associated with oropharyngeal cancers. Then beside that, the Epstein-Barr virus is another virus which associated with nasopharyngeal cancers. So this sort of infections. Beside that, if we go some occupational hazards, some workers working in wood dust area, they are more prone to develop nasopharyngeal cancer than nickel dust, and then paint industries. They also have chances of developing the head and neck cancers. Beside that, some genetic predispositions is also there, but they are very rare. Like some cases of Fanconi's anemia, they are associated with head and neck cancer. So if we look at that, the major cause of head and neck cancer is addiction, that is by tobacco and alcohol.
Mhm. Okay, doctor. So when it comes to head and neck cancer, is it more common in males or females?
Yeah. Again, since our practice is associated, this head and neck cancer is majorly associated with addiction, and we have observed that the major addiction, whether it is tobacco or alcohol, it is more profoundly found in male. So all the studies shows that the head and neck cancer has some more preponderance toward the males. If we consider it in ratio, then it is nearly 2:1 to 4:1 in male to female pattern. So we can say that male are more prone to develop head and neck cancer, but nowadays we also observe that most of our female patients are also developing head and neck cancer. So it is rising in female patients also. If we see for any data, then for India, head and neck cancer is one of the most common, oral cavity cancer is one of the most common cause of cancer in male, but for female also it is nearly fourth or fifth place. So we can say that in female also this trend is rising.
Okay. So, doctor, if somebody has a family history of head and neck cancer, so does it increases the risk?
Uh, Currently, there is no direct predisposition of familial history of having head and neck cancer. But yes, like I said, that patients with Fanconi anemias, they are familial disorders, they are autosomal recessive disorders which can transfer to the child. So in those patients, chances of developing head and neck cancer are more high. प्लस इफ वी ऑब्जर्व द जो जुड़वा बच्चे होते हैं उनमें एक चांस, एक में है तो दूसरे में रिस्क बढ़ा हुआ है, ऐसी कुछ स्टडीज हैं। या जो फर्स्ट डिग्री रिलेटिव्स होते हैं उनमें भी चांस होता है, बट इट इज लाइक ब्रेस्ट एंड ओवेरियन कैंसर, इट इज नॉट वेल एस्टेब्लिश्ड इन केस ऑफ हेड एंड नेक कैंसर, बट यस देयर इज सर्टेन रिस्क विद फैमिलियल हिस्ट्री।
Okay. So, doctor, my next follow-up question to this is, can head and neck cancer spread? I mean, is it contagious?
No. It is not. Cancer are not contagious like other viral infections. They are not contagious, but yeah, they can spread. इनका जो स्प्रेड होता है दैट इज डिफरेंट फॉर एन oncologist पॉइंट ऑफ व्यू। कैंसर के एक विशेषज्ञ के नजरिए से यदि देखा जाए तो इनका स्प्रेड हम बोलते हैं जब वो एक साइड से निकलकर दूसरे साइड पर फैल रहा हो, जिसको हम जनरली मेटास्टेटिक वर्ड यूज करते हैं। तो इट कैन स्प्रेड टू नोडल रीजन्स, लाइक मुंह का कैंसर है तो वो गले में जो नोड्स होती हैं, गांठें होती हैं, उनमें आ सकता है। इट कैन स्प्रेड टू डिस्टेंट साइट ऑल्सो, लाइक ओरल कैंसर कैन स्प्रेड टू लंग्स, बोन्स ऑल्सो, but it is not considered as contagious.
Mm-hmm. Okay. So, doctor, next question is related to this only, that oral cancer or throat cancer that is related to HPV, human papillomavirus, is that
Yeah.
contagious?
We can't say contagious, but it can cause other problems also. So it's not that what cancer can be spread, But HPV infection can be spread. So if a person is prone or immunodeficiency has in that person, they can develop various spectrums of HPV infection. One of those is cancer. So yes, HPV infection is contagious, but it will not create cancer in all the patients. Uh,
Okay.
uh, you raise a point of HPV infection, so it can cause spectrums of diseases like infections and various sites of body can be affected by HPV infection, but not as necessarily that it will lead to cancer.
So, doctor, what are the chances of surviving head and neck cancer?
Head and neck cancer, okay. When we are talking about survival in head and neck cancer, it is very important to check at which stage we are treating the patients. Normally, what happens कि like in हम यदि डिस्कस करें जैसे ओरल कैविटी का कैंसर है, जनरली कैंसर जब स्टार्ट होता है यदि ओरल कैविटी के का एग्जांपल लें वो एक ग्रोथ के रूप में स्टार्ट होगा लेकिन उसमें दर्द रहित रहता है वो जब दर्द रहित कोई कैंसर होता है तो मोस्ट ऑफ द टाइम पेशेंट्स उसको निग्लेक्ट करते रहते हैं और उसके कारण जब तक वो टर्शरी या स्पेशलिस्ट के पास पहुंचते हैं कैंसर स्पेशलिस्ट के पास तब तक उनका वो जो अनटिल अनलेस उनको वो कोई प्रॉब्लम क्रिएट ना करे लाइक वो इंटरनली स्प्रेड होकर नर्व्स को कंप्रेस ना कर रहा हो तब तक वो पेशेंट डॉक्टर के पास नहीं दिखाते. For that reason, when we receive the patient, generally they are in upstage or higher stage side. So, if you ask for survival, it all depends upon the staging of the tumor, beside other thing. So, if we say for whole total of all the stage, it is nearly 50%. Normally, if in terms of head and neck cancer for India, there are nearly 1.5 lakh patients per year, new cases. Out of that, nearly 75 to 80,000 deaths are there. So if you consider it as a data, so we can say that 50% survival is there for head and neck cancer. But due to early detection, now it is survival is on rising trend. But it all depends upon which stage patient are getting to us. If it is early stage, survival is very good, very high. If it is late, it generally dip to 20 to 30% for 5 years.
ओके. सो डॉक्टर, ट्रीटमेंट के बाद कभी ऐसा होता है क्या कि कोई चांसेस हो रिकरेंस के कि ट्रीटमेंट करा लिया है
Yeah,
उसके बाद भी हो गया हो हेड एंड नेक कैंसर?
yeah. So not only in head and neck cancer, in all type of cancer, there are some chances of recurrence also. That data we are telling that 5 year survival is nearly 50%. That's because even after a complete treatment, even in case of stage 1 disease, there are still chances. Although it is very less for stage 1 disease, but it is there. So chances of recurrence are always there. बट फॉर दैट पर्पस हम पेशेंट्स का फॉलोअप जरूरी मानते हैं. आपने यदि स्टेज 1 पे भी हमने उनको ट्रीट किया है वेदर इट इज सर्जरी और रेडियोथेरेपी और थेरेपी और कॉम्बिनेशन, आफ्टर दैट वी रिक्वायर अ विगरस फॉलोअप फॉर द कैंसर पेशेंट्स. For first year, the chances are very high of recurrence. So for first year, generally we used to call the patient within 2 to 3 months of the period, so that if any abnormal recurrence can be seen, so we can treat it early. If it is okay for 1 year, then we can expand the time period of follow. So this forehead and neck cancer, we go up to 5 years. For 5 year हम पेशेंट्स का फॉलो अप रेगुलर रखते हैं because there are chances of recurrence up to 5 year, maximum chances. After 5 years also there is chances, but we can safely say that if it does not come in within 5 years, so we can tell the patient that you are cured by cancer. So that period is very high, very long, 5 year. So up to that period, chances of recurrence are there. So patients should be kept in follow till at least 5 year of period.
ओके ओके, थैंक यू डॉक्टर. सो डॉक्टर, आई थिंक आई एम डन विद माय क्वेश्चंस, बट आई थिंक हमारे व्यूअर्स के पास काफी सारे क्वेश्चंस हैं आपके लिए, तो हम कुछ क्वेश्चंस
Okay.
वहां से ले लेते हैं. जी.
बिल्कुल बिल्कुल.
Yeah. So, Mehal Patel, she is asking that she wanted to know, can oral throat or tongue cancer can be cured?
Okay, so there are 3 different sides of head and neck cancer. You are saying oral, throat, and tongue. Tongue is included in oral cavity itself, but tongue is slightly notorious in terms of treatment. टंग के केस में जनरली क्रॉस मेट्स होते हैं, स्किप मेट्स होते हैं, सो टंग थोड़ा सा टैकी हो जाता है ट्रीटमेंट के लिए, बट यस इट कैन बी क्योर्ड if it in simple line I can answer it can be cured. Goal is to detect early and treat accordingly. So in oral cavity, if it is operable, we have to go for surgery and followed by whether treatment are required or not. For tongue also, for larynx, throat cancer, generally we used to call it a laryngeal cancer. Uh,
Mhm.
if it is not involving bone, we can go for voice preservation treatment, that is by radiation. And by that, if we are treating, there are chances that we can cure the patient. Again, the staging is important. यदि वो early stage है, तो chances of cure are very high. If late है, advanced stage है, then also chances of cure is high. Cure is there, although it is less than earlier stage. But yeah, we can cure the patient if we are getting appropriate treatment.
Okay. Next we have is Janvi Singh is asking that does head and neck cancer treatment affect swallowing and breathing?
Okay, if we are talking about that swallowing and breathing problem after the treatment of head and neck cancer, yeah, some patient may experience this problems. What happens कि जो head and neck का area है वो एक complex anatomy carry करता है. वहाँ पे बहुत सारे functions हमारे generate होते हैं, like speech हो गया, eating हो गया, swallowing हो गया. So after, like in cases of surgery by for head and neck cancer, a major portion of your head and neck area is removed. Again, after that, if we require adjuvant treatment in form of radiation, then again that some problems arises. So speech and swallowing may affect after the head and neck cancer treatments. Generally, radiation in earlier days when we used to treat head and neck cancer patients by cobalt. In that cases, salivary gland are getting much radiation. Due to that, हमारा saliva generation कम हो जाता था, तो वो हमारा swallowing में issue करता था, जिसको dryness of mouth बोलते हैं, वो develop होता था patients में बहुत. बट आज की डेट में सिंस एडवांस मशीन्स आर देयर, तो जेरोस्टोमिया के केसेस बहुत कम हो गए हैं, अब ना के बराबर ही होते हैं. देन अगेन ड्यू टू सर्जरी, एनाटॉमिकल डिफॉर्मिटीज, उनकी मुंह खोलने की क्षमता कम हो जाती है, टेस्ट चला जाता है, टेस्ट का सेंसेशन चला जाता है. ऑल दिस accumulate to create the problem of speech and swallowing. So yeah, they may develop speech and swallowing difficulty, but it can be rehabilitated by various therapies after the complete treatment of the primary treatment of the head and neck cancer patient, which includes either physiotherapy, speech therapy, vocational therapy, occupational therapy. All these nutritionists also play a major role in our treatment. So it's a combined treatment from diagnosis till rehabilitation. There is a teamwork for treating the cancer patients.
Mhm. Okay. Next we have is Vipin Gorana. He wants to know, is radiation therapy required for all patients with oral, throat, or tongue cancer? So tongue is, I think, included in oral only.
Yeah, tongue is also included in as a subtype of oral cavity cancers. Regarding radiation therapy, it is not always associated with cancer treatment. हम ये देखते हैं कि आप यदि कैंसर के ट्रीटमेंट में जाएंगे, हेड एंड नेक कैंसर के ट्रीटमेंट में, तो either we can go for radiation therapy or surgery. So if patient is going for surgery, so after surgery, generally we used to see the histopathology report. What are the stage? What are the risk factor which can cause recurrence of the disease in near future? सो हमारा रेडिएशन का डिसाइड होता है कि हम इन फैक्टर्स में से यदि कोई रिस्क फैक्टर है जो नियर फ्यूचर में वो कैंसर को रिकर कर सकता है, देन इन दोस पेशेंट वी यूज्ड टू गिव रेडिएशन. Not all patients, or in some patients we can give definitive radiotherapy. If it is early cases and we have that facility, we can give definitive radiation therapy in early cases. But it's not always necessary that head and neck cancer patients हैं तो उनको radiation लगेगा ही. It all depends upon the histopathology report.
Okay. Next question is Sumona is asking, that
Yeah.
how can the quality of life be improved after head and neck cancer treatment?
Okay. So again, the same thing is keep. I told you earlier that it is a multimodality treatment. We can go for surgery, we can go for post-surgical radiation therapy, and it may associated with chemotherapy. So all this treatment can lead to some dysfunction in the head and neck cancer patients. If we are going for surgery, there may be patient develop chances of speech difficulty, swallowing difficulty. So after the therapy, like I earlier stated, that we have a rehabilitation process regarding speech, swallowing, to improve the quality of life. So after therapy, role of physiotherapist, nutritionist, and then dentist, then occupational therapist, all this come in actions. So after that, जो ड्राइनेस ऑफ माउथ होता है, जो निगलने में परेशानी होती है, स्पीच में प्रॉब्लम होती है, लाइक इन केसेस ऑफ द larynx case, if we consider for laryngeal cases, if we go for surgery, like in advanced cases, if it involve the bone, we have to go for surgery. So after surgery, if you remove the larynx, the patient's voice is completely gone. सो उसको कैसे हमको आवाज देना है, उसके लिए वेरियस प्रोसीजर्स होते हैं, वेदर इट इज इन इलेक्ट्रोलैरिंग्स, वी कैन से कि एक आर्टिफिशियल वॉइस प्रोडक्शन डिवाइस होती है जिससे हम उससे उनको बात करवा सकते हैं. सो ऑल दिस कम इन रिहेबिलिटेशन पार्ट ऑफ द पेशेंट आफ्टर द ट्रीटमेंट ऑफ प्राइमरी कैंसर. सो इसके कारण इन चीजों के साथ हम क्वालिटी ऑफ लाइफ पेशेंट का बिल्कुल इम्प्रूव कर सकते हैं.
Next question is from Amit. So Amit Vasawa is asking, can the treatment for head and neck cancer affect speech?
Yeah, it can affect speech. If we go for surgery, then a part of your oral cavity, part of your tongue, part of your buccal mucosa are removed. Then because of the scar, because of the radiation, the patient may develop trismus. During the treatment, what happens is कि जब हम radiation का treatment करते हैं, as a part of the treatment, one side effect generally, usually 100% of the patient faces is the mucositis of the buccal mucosas or mucosas, due to which the patient generally keep their mouth shut during the whole process of the treatment. What happens is this कि जब आप 1-1.5 महीने तक अपना मुंह बिल्कुल नहीं हिला रहे हो, क्योंकि वो दर्द करता है जब आप हिलाते हो, तो उसके कारण जो टेम्पोरोमैंडिबुलर जॉइंट हमारा होता है, जो हमारा माउथ ओपनिंग करता है, वो स्ट्रिप हो जाता है. It is aided by the previously done surgery also. So after treatment, mucositis generally जो होता है वो depending upon आपका oral intake वो subside हो जाता है. But after treatment what happens कि आप वो स्टिफनेस दूर नहीं कर पाते हो, ये आपके स्पीच को अफेक्ट करता है. देन मूवमेंट्स ड्यू टू सर्जरी ये अफेक्ट करता है. सो ऑल ये जो ट्रीटमेंट्स एंड पोस्ट ट्रीटमेंट जो सिक्वली है, ये स्पीच को अफेक्ट कर सकते हैं. दैट्स व्हाई वी रिक्वायर्ड स्पीच थेरेपी, एंड वी हैव टू एनकरेज द पेशेंट ड्यूरिंग द ट्रीटमेंट ऑल्सो कि आप अपना प्रॉपर मूवमेंट करते रहिए ताकि वो ट्रिस्मस ना हो. आपका पोस्ट सर्जरी टंग का मूवमेंट अच्छा हो, इसके लिए स्पीच थेरेपी बहुत जरूरी है. So yeah, it may affect the speech, but it's not that we cannot overcome that hurdles.
Shraddha Devangan is asking that she wanted to know about the vaccination of cancer. So is there any vaccination or vaccine available?
So regarding head and neck cancer, if we are going, yeah, definitely not in India. We are not practicing it in India. But the one of the major cause of head and neck cancer is now considered that oropharyngeal cancer is now considered as a human papillomavirus infection. So for that, one vaccine is there, which is termed as Gardasil vaccine, which generally is against the various strains of the head and neck cancer, that is 16, 18, which are the major cause of head and neck cancer, and 31, 33. In India, generally, these vaccines are available for cervical cancer preventions in females. But as I stated earlier, that HPV vaccination is not only a cause of one type of cancer. It may cause multiple type of cancer. Like in male, it can cause oropharyngeal cancer, then anal canal cancers. So yes, in Western countries they are using Gardasil. Now in our part also we can start using it as a routine vaccination program for prevention of head and neck cancer. So we can say for head and neck, HPV vaccine is there.
Okay. Next question we have is from Pratik Bhatt. He's asking, is there any possibility of reoccurrence after the treatment? Any preventive measures? If you could suggest.
Okay. uh, we discussed it earlier that yeah, chances of recurrence are there, high chances if it is higher stage. So for that, first thing is after treatment आपको लगातार जैसे आपके ट्रीटिंग फिजिशियन ने कहा है फॉलो बहुत जरूरी है. मोस्ट ऑफ द टाइम हमारे एरियाज में पेशेंट क्या होते हैं कि जैसे ट्रीटमेंट हुआ उनको ये लगता है कि अब हम ठीक हो गए हैं एंड दे जनरली डिफॉल्टेड फ्रॉम फॉलो अप. जब हमारे पास वो 1 साल 1.5 साल बाद आते हैं डिसीज इतना ग्रो कर जा रहता है कि वो एक सॉर्ट ऑफ पैलिएटिव ट्रीटमेंट में चले जाते हैं. सो फर्स्ट थिंग इम्पोर्टेंट इज फॉलो. नाउ फॉर प्रिवेंटिव मेजरमेंट्स अगेन अवॉइड एडिक्शंस. आप ऑलरेडी एक बार कैंसर डेवलप कर चुके हो और उसके बाद भी यदि वो एडिक्शन आपने नहीं छोड़ा है तो देयर आर चांसेस कि वो रिकर करेगा एंड दूसरी साइड पे भी रिकर कर सकता है. Then live a healthy lifestyle, eat a healthy diet, exercise, yoga. All this help in uh, boosting your immunity. There is no particular sets for prevention, but yeah, you can avoid it by taking this healthy lifestyle.
Next is Mani Ramachandran. He's asking, what is the cause of head and neck cancer? For oral, cause of chewing tobacco or using smoking. So he's asking,
Oh,
what are the causes?
okay. So basically, if we search for a particular cause for head and neck cancer, it is not there. Generally, cancer is due to a multifactorial cause. We can't pinpoint that if this guy is chewing tobacco, then he will definitely develop cancer. We can't say that because we in our neighborhood we saw some person taking tobacco for many years, but it's still okay. So जो कैंसर डेवलपमेंट होता है ये एक मल्टीफैक्टोरियल कॉज होता है. बट हाँ, टोबैको एंड अल्कोहल ये दोनों एक बड़े और मेजर कॉज हैं हेड एंड नेक कैंसर के लिए. च्यूइंग टोबैको जो हमारे गांव साइड में ज्यादा यूज होता है. जनरली यूज टू सी कि आप जब एक टोबैको लेते हो, जनरली जो स्मोकलेस टोबैको होता है जो हम गुटखा बोलते हैं, वो पर्सन यूज टू जो रखते हैं वो किसी एक साइड पे रखते हैं तो वहां पे कंटिन्यूअस उस म्यूकोसा का इन्फ्लेमेशन और डिस्प्लेसिया होते रहता है. तो चांसेस ऑफ डेवलपिंग कैंसर एट दैट पर्टिकुलर साइट इज वेरी हाई. So yeah, tobacco is one of the major cause. Generally, any form, whether it is smoking or chewing, any form, it is a major cause. But yeah, chewing the smokeless tobacco is major in head and neck cancer. Smoking can cause head and neck cancer, yes, and it can also cause lung and other type of cancer. So, in any form, it can lead to cancer.
Okay, okay. I think, Doctor, we are done with the viewers' questions too. So, thank you so much for such an interesting and insightful session. It has added a lot to my knowledge, and I'm very sure that it has added a lot to our audience knowledge as well. So, I would like to tell my viewers that I hope you guys had an amazing session too. And if you or someone you know ever want to consult for cancer, you can always visit Dr. Satish Devangan at Sanjeevani CBCC USA Cancer Hospital, Raipur. Thank you so much,
Uh,
Doctor.
thank you for
Would
giving
you
me
like to
this.
add something?
Yeah, just two
Yeah,
words.
please.
Thank you for giving me
Yeah,
this
go ahead, go
splendid
ahead.
opportunity to talk in front of live audience regarding various aspects of head and neck cancer. Again, since we all know that this month is head and neck cancer awareness month, so viewers से मैं यही कहना चाहता हूँ कि इसे नेग्लेक्ट ना करें. आपको यदि कोई भी लक्षण है, कोई भी ऐसे दिक्कत है जो अभी हमने डिस्कस किए वो है, नियर बाई जो भी आपके स्पेशलिस्ट कैंसर हॉस्पिटल्स हैं या आप जिस भी डॉक्टर के पास जाएं, जो भी स्पेशलिस्ट हैं, जरूर जाएं, इसे बिल्कुल नेगलेक्ट ना करें, क्योंकि हमारे हाथ में ट्रीटमेंट होता है, और यदि ये ट्रीटमेंट हमने अर्ली स्टेज में किया तो बहुत ही एक इम्पैक्टफुल लाइफ हम दे सकते हैं, हम आपको सर्वाइवल दे सकते हैं, इसको क्योर किया जा सकता है। इट ऑल डिपेंड्स अपॉन कि आप कितनी जल्दी उसको अ, लेके अपने डॉक्टर्स के पास जा रहे हैं। तो प्लीज इसको इग्नोर मत करिए, बहुत जरूरी है। वन ऑफ द मेजर कॉज ऑफ डेथ फ्रॉम कैंसर इज दिस हेड एंड नेक कैंसर। बहुत जरूरी है कि हम इसको सीरियसली लें, और ऐसा कोई भी लक्षण है तो नियर बाई हॉस्पिटल्स में दिखाएं। अगेन थैंक यू वेरी मच फॉर माइंड मी।
थैंक यू सो मच डॉक्टर। सो जैसा कि
थैंक
डॉक्टर देवांगन ने फिर से कहा कि अगर आपको कोई भी सिम्टम है या आपको लग रहा है कि कुछ भी अगर है जो अनयूजुअल है, तो आप बिल्कुल उस चीज को निग्लेक्ट ना करें और जल्द से जल्द किसी भी नजदीकी स्पेशलिस्ट से मिलें। थैंक यू डॉक्टर, थैंक यू सो मच।
थैंक यू वेरी
See
मच।
you, have a good day. Yeah.
थैंक यू।